Preventing anemia, simple strategies for a healthier you. Anemia is a condition that occurs when the body lacks sufficient red blood cells or hemoglobin to transport oxygen around the body. This can lead to feelings of tiredness, weakness, and shortness of breath. One of the most common symptoms associated with anemia is fatigue, which can be accompanied by weakness and difficulty concentrating. This is because without enough oxygen being transported around the body, it cannot function as effectively. Other symptoms may include pale skin or yellowing of the eyes and skin, jaundice, dizziness or fainting spells, irregular heartbeats, headaches, and cold hands and feet even in warm weather. Causes of anemia, genetics, kidney problems, and infection. The symptoms of anemia include tiredness, weakness, shortness of breath, dizziness, headache and pale skin. There are several causes of anemia, including genetics, kidney problems and infection. One cause of anemia is genetic factors. Another cause of anemia is kidney problems. Lastly, infections such as malaria can also lead to anemia by destroying red blood cells directly or by causing inflammation which suppresses their production in the bone marrow. Assessment and diagnosis of anemia, blood tests and eye exams. Anemia is a medical condition characterized by a decrease in the number of red blood cells or hemoglobin concentrations in the blood, leading to a reduced capacity of the blood to carry oxygen. Some common symptoms of anemia include fatigue, shortness of breath, weakness, pale skin, dizziness and headache. Assessment and diagnosis of anemia are typically done through blood tests and eye exams. Blood tests are used to measure various components such as red blood cells count, hemoglobin levels and hematocrit, red blood cell percentage. These tests can help identify different types of anemia such as iron deficiency anemia or vitamin B12 deficiency anemia. Another test called reticulocyte count measures how the bone marrow is producing many young red blood cells. Eye exams are also used to diagnose anemia in some cases. This is because when there isn't enough oxygen supplied to tissues due to low hemoglobin levels, it causes changes in the small vessels at the back part of the eyes which can be seen during an exam. The appearance of these vessels helps doctors determine whether an individual has anemia or not. Overall, prompt diagnosis and treatment are crucial for managing this condition effectively before complications arise. Treatment of anemia, iron supplements, blood transfusions, and dialysis. Anemia is a condition that is characterized by a deficiency of red blood cells or hemoglobin in the body, leading to fatigue, weakness, and shortness of breath. The treatment of anemia depends on its severity and underlying cause. In most cases, iron supplements are recommended to increase the levels of iron in the body and boost the production of red blood cells. In some cases, however, oral supplements may not be enough to correct severe anemia. Blood transfusions may be recommended to replace lost blood due to injury or surgery. This treatment involves receiving donated blood that has been screened for safety and compatibility with your blood type. Prevention of anemia, vitamins B12 and D, exercise, and a healthy diet. Anemia is a condition characterized by low levels of red blood cells or hemoglobin in the blood. It can cause fatigue, weakness, shortness of breath, and irregular heartbeat. While different types of anemia are caused by various factors such as genetic disorders or chronic diseases, some can be prevented through lifestyle changes. Vitamins B12 and D play crucial roles in the production and function of red blood cells. Vitamin B12 helps with the synthesis of DNA necessary for cell division, while vitamin D regulates calcium absorption needed for bone health and muscle function. Incorporating foods rich in these vitamins into one's diet can help prevent anemia. Exercise also promotes the production of red blood cells as it increases oxygen delivery to muscles that require it during physical activity. A healthy diet that includes iron-rich foods like leafy greens, meat, seafood, beans, nuts and fortified cereals is essential for preventing certain types of anemia caused by iron deficiency. Consuming enough vitamin C from sources such as citrus fruits and tomatoes also helps improve iron absorption from plant-based foods. Overall, a balanced diet combined with regular exercise and adequate sunlight exposure can go a long way in preventing anemia due to nutritional deficiencies.